When working in a community sector setting, like a refuge, a drop-in centre or lodging, we make sure we put on our PPE in a clean, safe space just before interacting with clients and remove and dispose safely immediately after that client work is finished. I want to make sure that I've got a clean and dry space ready to put on my PPE. I've cleaned my hands, I'm going to wipe and dry the surface and give myself the time and space to put on my PPE safely and correctly. Then I'm going to go and collect my PPE and put it on that surface so I can get it ready. In a community setting, we want to make sure that our PPE is stored somewhere that's really accessible with no clutter in front, somewhere dry and somewhere clean, away from toilets, cleaning products and food. In a setting like this, I'd store my PPE in a cupboard. When determining which PPE I need for each situation, I want to think about the work I'm going to be doing and the risks involved. Before I put on my PPE, I want to make sure that I'm bare below the elbow. I've taken off my jewellery and I'm going to check that my hands are clean and that I've got no cuts or abrasions that need to be covered. When we're donning PPE, it's really important to get the order right. We use a clean to dirty approach. First we put on our apron, then we put on our mask, then our goggles, and then our gloves. When you're putting on a gown, it's important to make sure that it's a new gown. Gowns are disposable. It needs to be a clean, dry gown with no holes or cuts in it. You need to put it over your head, tie it around your waist to make sure that it's secure. It's important with the mask that it covers your mouth and nose. Place the ear loops over your ears. The mask needs to be moulded over the bridge of your nose and cheeks to secure its fit. And it always needs to be a new mask. With eyewear or a visor, make sure that the eyewear is secure on your face and that it's able to protect you from any splashes. When we're putting on gloves, we need to be really careful to make sure that our hands are ready to have the gloves on. We need to be really careful for any rings or anything that could cut a glove. If there's a hole in the glove, it takes away the protection that the glove gives us. We need to make sure that when our gloves are on, our watches are off and our rings are off. Make sure that there's no sharp nails in the gloves and make sure that any cuts are covered with band-aids. When I've finished my client work, as soon as I can, I'm going to take off my PPE safely and as close to the point of use as possible to make sure I minimise any risk. I'm going to take off my gloves. I'm going to take off my gown, my goggles, and then my mask. And in between each step, I'm going to hand sanitize. I'm going to safely dispose of all my used PPE. After this, I'm going to wipe down the surface with disinfectant so it's safe and clean for the next person. It's always important to make sure that the people that we're working with feel safe and supported, and it's our job to make sure we protect them.